Well, I'd say the meeting was a success really on several levels. And in terms of key takeaways, one key one was that a virtual format really lent itself very well to the MPN community. It's a very diverse community and spread really throughout the world, and we were able to include faculty from many countries and participants from over 30 countries in a way that, had it been solely a live face-to-face meeting, really wouldn't have been possible. So the format was great. We had over 1,300 people participate in over 30 countries. And if it had involved airplane travel, would never nearly have been as big or allowed that degree of involvement. Second, our goal had been to have a very interactive meeting, and despite the virtual format, it was very successful in that regard. We had great live panel discussions, and people being able to submit their questions online really led to a great discussion and workshop. Third, the session on COVID and MPNs, I think, was particularly impactful, bringing together experiences from around the world, from Italy, from Bergamo that had been heavily hit, from New York and others, both in terms of firsthand anecdotal experience, as well as some of the evolving data. So we got tremendous feedback on that. And finally, this really first MPN-focused meeting of 2020, so many others having been canceled due to the COVID crisis, really allowed a robust chance to discuss the pipeline, ongoing clinical trials, and really help bring everybody up to speed on this rapidly evolving area. Another takeaway, I think, as it was available in real time, and people saw the meeting going on in social media, many others joined the meeting and the conversation. So that was wonderful in the sort of way that a traditional live face-to-face meeting never would accommodate.